Hello. Hi, everyone. I'm myself, Dr. Akil Kohli from MedXperts. Today, we are delighted to have you among us. On behalf of all the members and management, we would like to extend our warmest welcome and good wishes to every one of you.
Hello, hi. I'm myself, Dr. Akil Kohli from MedXperts. Welcome you all back once again. This is a recorded onboarding session. In case of any questions, you may ask us through official WhatsApp or write us through an email at support@medexpertsindia.com. Before going into the technical details, I would like to introduce you to the MedXperts. We are 1.5-year-old startup company working on digitalization of healthcare. We provide software technologies for patient management and e-prescription solution. The concept of free telemedicine practice was started aimed at COVID-19 crisis. There are many people who are unable to attend medical care due to the lockdown. Our primary objective is to help majority of them through free telemedicine services. However, telemedicine can never replace the actual practice where there is a need of physical examination. But we believe it could at least help in preliminary diagnosis and treatment of mild to moderate conditions. Post COVID-19 crisis, we would like to extend our services for commercial use, where patients can consult the doctors through telemedicine, and based on the patient condition, doctors will be providing appointments for clinic consultations if there is a need for physical examination. This kind of practice could reduce the risk of infections to both the practitioner and patient, and also help in preventing the spread of infectious diseases in the waiting hall of hospital OPDs and clinics. We'll keep this software free of use for lifetime for COVID-19 volunteers. So once these free telemedicine practices are started, we would like to extend these services as discussed before for advanced patient-centric care, which is profitable to the provider and patient. And apart from this, coming to the onboarding session technical details, I would like to take you to MedXperts. And so whenever you want to use MedXperts software, just go to the URL ehr.medexperts.in. So you will be asked whether you are a user or a provider. So doctors and hospitals need to check in as provider. And so this is my details, my login details. So all the doctors are registered on the phone number. However, you may log in through your hospital login. And before going into this, I would like to show you the console of MedXperts doctor login. So once I click on login, I'll be taken into my dashboard where I can see all my appointments for today, tomorrow, and all these things. There is a patient at 3:30 to 3:45. And this is the regular clinic consultation appointments and paid telemedicine services. So we have a cases tab where we can see all our patients in a list. So these all are the patients. And so coming to the telemedicine tab, this is an overview. So I have a patient who's waiting for the telemedicine consultation, whose preferred language is English. And I would like to take this patient, accept this free telemedicine request. So I click on details, I check the patient details. So he has requested me for 1:45 p.m. He placed a request at 1:45, and his preferred time for consultation is 3 p.m. However, because I'm busy, I'll be posting at 3:30 p.m. So once I click on confirm, the date and time was confirmed. So once I click on accept, the patient will be moved to upcoming. So I have a list of upcoming patients, and I can filter them based on time and date or priority. So as per the time and date, I have a patient here at 5th May, which was scheduled at 3:30. So because it's time to call the patient, I'll just, before going to call, I can recheck his details, why he has applied for free telemedicine. And so I can start a telemedicine call by clicking this call button. So when I started clicking the call, my phone and the patient phone both will be ringing. So this will work in this way. So patient places a telemedicine request either through his mobile application or through a phone call to the primary consultant, and we place the request in the software. So as a practitioner or a provider, you see the patient request and accept the patient request, schedule a telemedicine time. In our software, once you click on start case, a call will be placed between the doctor and the patient through a virtual number, so that the doctor's personal mobile number or the contact information will not be directly shared to the patient. And this is important to protect the privacy. So we are providing these services through a virtual number. And once the virtual number calls both the doctor and the patient, we can talk with each other, and based on the conversation I can start writing a prescription. However, it is hard to collect vitals during telemedicine, but nowadays use of smartwatch and smart devices for home health monitoring devices are growing in number. So if the patient is providing you some details regarding his temperature, blood pressure and heart rate, whatever details are being provided, we can enter those details here. So height in centimeters. So BMI will be automatically calculated and show you the complete details. And once we are finished with writing the vitals, we can go to clinical notes. The best thing with MedXperts is like you don't need to type everything. You just simply need to go select the condition. Like currently I'm writing patient complaints. So a known history of some complaints related to a medical condition of head, of sinus, headache, frontal sinus. In case you want to write since 2 years, you can add a note. So just click on add and next. So known history of medical condition, headache, sinus headache, and notes is frontal sinus pain since last 2 years. So this is a known medical history. So in the same way, I can write complaints of the patient, and patient complaints could be pain or a symptom. So pain related to shoulder pain, I can write the notes of shoulder pain, shoulder joint pain, or whatever the patient is complaining about. Or I can write a symptom related to a body organ, abdominal discomfort with epigastric discomfort. Based on the patient complaints what he is providing, we can write these things. And once we are done, we can write objective evidence. However, without physical examination, writing objective evidence is little tough. So on examination, review of systems, based on the questionnaire, patient questionnaire and patient answers, we can write these things. Like if there is any pain or discomfort, and since we can add a notes to this. So we have written complaints and objective evidence without even typing anything. And similarly, we can write a diagnosis. So we can write diagnosis, and this will be coded through ICD coding, ICD-11. And you can select any system like infectious diseases, gastrointestinal infection, and viral investigation. We can write like foodborne gastrointestinal or gastroduodenalitis. And we can just click on add and next, so the diagnosis will be recorded. So in similarly, when we write to assessment, if it is a follow-up case, we can assess sinus headache on, we can keep an advanced form. So whether the patient is performing good on regular treatment or the patient is performing poor. So we can write the status, if the status is still active or the problem has been resolved. And we can add a notes. So just click on add, so the assessment can be updated for a particular condition. Similarly, we can write a medication order. Just click on the medication name. You can select anything like based on the generic name, or we can write based on the brand name. So there is the auto search option here. So if we type few alphabets, it will be automatically searching for the concerned medication. And once we select the medication, the formulation and route of administration and what quantity to be taken and at what frequency it should be taken and how long it should be taken, all this information will be auto-filled based on the general prescribing patterns. And anyway, we can modify this information as per the patient requirements, clinical requirements. and with food, without food, such instructions can be given, and any additional instructions if required can be given with the prescription. And once we click on this add button, that will be added into the medication orders. So formulation type, tablet, route of administration, oral, and medication name, and take one tablet every 5 hours after food for 3 weeks. So sign is take one tablet every 5 hours after food, don't take alcohol. So everything will be updated into the medication orders list, and this search will be very elastic search, so that we can search based on the brand name or generic name, and all the information will be auto-filled. So next thing we can see is like recording the lab orders. So lab orders are generally recorded on type of order. You can select biochemistry or radiology or microbiology, what kind of test you are prescribing. So in this case, I'll take radiology. However, I can make a general search here with in the search bar. So I got a liver function test, so I can select all the tests related to this, or I may select only the tests required for the patient, for this particular patient. And I can give test related instructions like collect the sample in the morning or collect the sample with empty stomach. I can add additional information by just giving some information in the notes, and I can add it in the laboratory orders. So in the same way, I can write a biochemistry test, thyroid profile test. I can select all the tests, and I can give test related instructions, and I can add it to the lab orders. Similarly, I can write a care plan without typing. So I can write nursing orders, and I can write diet related orders for a particular diet, and I can select like I can search the diabetic diet. So I have diabetes, and I can recommend a particular diet related instruction like very low fat diet, increase the protein diet, and low sodium diet. I can add these instructions, and there is a diet related care plan which is related to diabetes. Instructions are very low fat diet and increase the protein diet, and low sodium diet should be taken. So these things are recorded in the care plan. And once I feel that all the information required for the prescription is recorded in the prescription form. And one thing, while recording the medications, you can go through the patient current medication in the patient dashboard. So generally these are the active medication patient is using, and if there is any such medicine you want patient to stop, you can create a stop order. And if you would like to see much more information regarding his medication care plan, you can browse through the dashboard, or you can check in the medication history. So all the history related to social history, medical history, everything is recorded in this tab. So you can see the preferred languages of the patient. You can view and edit all these options, and you can see the medical history, past medical history, and surgical history. Similarly, you can see the medication history, what is the active, whether the medication is active in status or stopped, and allergic history can be seen. So allergic history can also be written, like you can add any new allergies you identified from the patient interview, like drug related allergies or any food related, environmental related allergies can be recorded, and family history can be recorded. And similarly, we can see the immunization history of the patient and record the new immunization history. And apart from this, you can see the patient uploads, and since the patient do not have any uploads, we can see the health tracking of the patient, and particularly how he is managing his diabetes at home. And so you can ask the patient to track for a particular condition of or symptom, and you can create a health tracking order. Similarly, you can see his demographic information, and we have once you feel that the prescription is completely right for the patient and all the medications are ordered and everything is clear, you can just click on complete case. So this case will be completed, and once you click on complete case, you cannot edit the prescription since the case has been closed. Prescription to view the prescription details, you need to go to summary tab. So in summary tab, we can see all the medication related orders. And once you click on complete case, you can see the complete case details, what has been prescribed to the patient. And if you feel that everything is right, you can share the case directly with the patient. However, you may choose what information to be disclosed in the prescription. And you may choose to share it via WhatsApp or through SMS. And once you click on share, the patient phone number and email ID will be popped up. And anyway, if you find the patient phone number to be wrong, you can edit the patient phone number, or you can share it. If it is everything is right, you can click on share button. So the prescription will be shared to the patient directly to his mobile via WhatsApp, SMS, and email. However, the patient can also check his prescription through the MedXperts application in his mobile. And if required, you can book a follow-up for the patient. So you can set a reminder when he need to when there is a need for follow-up, and you can select the reason for follow-up. It could be for the review of treatment or lab reports or continuity of care. And if required, if you prefer that the patient require another specialty of care, you can choose a different specialty of care and refer the patient to a particular specialty. And once the case is shared, we protect the privacy of patient information. So the patient authentication is important to see the demographics and history. And since this case, I have already taken the authentication. So authentication is generally happens with the new case. So suppose if I have a patient case of a particular patient case, let's see with upcoming cases. So if I have a particular case, which I do not have authentication, so the authentication is there for this case. So let me choose another case. So I'll take this case. And so since I'm taking this case, the patient is not authenticated. So I can't see his dashboard, or I cannot see his medical history. So I need to click on patient authentication. So there is a OTP that will be sent to the patient. So once we enter the one-time password, we can, once it is verified, we can see the complete patient medical history and all these things. So this is how we protect the patient privacy. And once you complete the prescription, you click on complete case. All the patients who are prescribed by medications will be in the My Patients list. And you can cross-check the prescription details. If required, you can share it again to the patient as per the patient request. Or you can print the prescription and keep a record of the prescription. So, however, the overall thing is like the patient may raise a telemedicine request through his mobile app or through the web application, or he may call the clinical coordinator who will raise a request on behalf of patient. So once the provider or healthcare provider or the doctor accept the request, he schedule the appointment time. So once he click on the start case based on the scheduled appointment time, there is a virtual call center which will place a call to the doctor. And once the doctor left the call, the virtual call center will also place a call to the patient. And if the patient left the call, the doctor and patient talk to each other. And a prescription written during this conversation will be added to the database, and that can be shared directly to the patient via WhatsApp or SMS and email. However, the patient can access all his prescriptions through mobile application or web application. And even the clinical coordinator can go through the patient prescription and provide proper medication use counseling to the patient as per the prescription. So this is how the MedXperts work, and hope you will have a wonderful experience using the MedXperts application. And hope this free telemedicine services reach every corner of the country, and this becomes a very good success. And hope this will be very helpful for everyone around. Thank you so much for joining. And once again, I'm really happy to welcome you all. So let's do our best. Thank you so much.